Could vision therapy help you? Maybe your child. We'll take a look just ahead. And Andrew will be here with How to Be a Gentleman. And it's our birthday, and we're giving you the presents. Our first giveaway is coming up. Mid-morning starts right now.
WCBI's Mid-Morning with Andrea, breaking away from your everyday.
Good morning, everybody. Happy birthday to us, first of all, but we're going to get to this first. Our eyes are supposed to work together. Each records an image. Your brain then fuses those images together. That simple system can break down, though, for a number of reasons. But visual therapy can get everything back on the same page. It helped a local boy in the classroom and the soccer pitch. He and his mom tell us all about it. Take a look.
Seth Swain is a smart, outgoing, and athletic 10-year-old boy. He's finishing up a series of visual exercises at Snyder Therapy Center in Columbus.
My reading and my writing, my penmanship, and I learned how to do that better from vision therapy.
Seth and his older brother both struggled with eye tracking issues. It's a problem that can be subtle and hard to pinpoint if you don't know what to look for.
I think his words would run together when he was reading. Like, I don't really think his letters jumped off the page like some people's do, but I do think his letters ran together, and he wasn't able to comprehend them like he can now.
Therapy can even be fun. Seth's balance and coordination are put to the test on the beam and the trampoline. He catches, he dodges. Everything serves a purpose.
Help me use stuff in my head.
You could do math problems better in your head now, just through your eyes?
Seth is excelling, and so's his brother.
From a 22-year-old to a 10-year-old, we have seen major differences in both of our boys, and if I had it to do all over again, I'd do it again and again and again.
And once Seth is finished, he'll likely never need vision therapy again.
Well, symptoms of an undiagnosed vision or sensory problem include headache, sloppy handwriting, and a short attention span. If your child is already falling behind at school, his eyes should be the first place you look. Maybe glasses or contacts could help, but some vision problems go much deeper than that. Angie Huskisson from Snyder Therapy Center in Columbus joins us with what you need to know about the benefits of vision therapy. And it's great to have you here with us this morning, Angie.
Thank you.
We love talking about different ways to do things. You know, sometimes you have to look for unconventional ways to solve some problems, and this looks like it fits the bill here.
Right.
Go ahead.
It does. It's certainly something that may not be very well known here in the Southeast, just because there are probably very few doctors that actually practice this. This is actually a field of developmental optometry.
We spoke on the phone, and you told me how you really got interested in vision therapy, and I want you to share that with our viewers, because it may be somebody else's same story,
right,
and it could help them to decide maybe they should try this. It has to do with your brother.
It does. Very long story short, and he has given me permission to use his story if it would help other people. But at the age of 31, we found out that he was struggling with binocular vision problems, pretty severe binocular vision problems. He had 20/20 eyesight with contacts, so he had had routine eye exams. But this was just never picked up. It was actually never tested for, and he struggled for years in school. It took him 8 years to get through college. He was called to the ministry, and we certainly didn't want to talk him out of that, but we thought, how are you going to do that? He needed to take 110 hours. And 8 years to get through college. And so, long story short, again, we found Dr. Snyder, and after about 4.5 months of vision therapy, his visual issues were corrected. He can now read for 2 or 3 hours at a time, is off his medicine. He was on Strattera for ADD, no longer needs that.
Completely different way he processes everything.
And that's exactly what it boils down to, is how we process what we see and how we make sense of what we see.
Well, how do we know, or who's a good candidate to even be screened for vision therapy rather than going sort of the traditional route of glasses?
Right. I would say anyone that struggles in school, a child that struggles in school, if they're just having trouble performing what parents especially know is what their potential would be. I always knew that my brother was very intelligent. In fact, we've joked, I wonder what his IQ is. But we just knew that he was very smart, but he could not he made decent grades, but it took him hours to do homework. He could only read for 5 minutes at a time. And so most children that have binocular visual issues do struggle in the classroom.
Well, you have brought with you today some of the items that you use during therapy. I want you to just sort of go over some of the things that actually happen during a therapy session.
Okay. Well, and as you could see with Seth, we do a lot of gross motor work. We do a lot of balance because vision affects our balance issues, eye-hand coordination. But we also do a lot of things seated, where we actually work on having the individual learn how to control his or her eyes at near point, which is near point vision is what we need. Visual skills, good visual skills at near point is what we need to be successful in the classroom.
Okay.
And so, for instance, this is an aperture rule. And depending on which slide we have here, we will be focusing on the eyes converging or either diverging if we're using this slide. And so we actually help the individual learn how to control his or her eyes, and we're able to tell if the brain's actually suppressing an eye.
Okay. All right.
This is a procedure that we give for them to take it home, and we use red-green glasses, and again, we're able to tell, are the eyes working together by the feedback that they give us. And so they actually pull the slide, and their goal is to keep the image single and clear.
Okay, so there are things that you do in the office, but also things you can do to take home.
Right.
Okay.
Right. They generally come to therapy 2 times a week, 45-minute sessions each, and then they may have 10 to 15 minutes at the most of home vision therapy on the days that they don't come to therapy.
Now, if someone wants to bring a child in to be screened, what's the screening process like?
They just need to call our office, and we can set that up for them. It generally takes 45 to 50 minutes for the screening, and then we're able to go over with the parent at that time as far as if we see any reason for a further evaluation with Dr. Snyder.
I would assume that each patient, it's a case-by-case basis when you'll start seeing results. But generally, if, these are the problems that they're having and they can benefit from the therapy, when should they start seeing some change, maybe, you think?
It is certainly very individualized. Some patients see changes within 3 to 4 weeks, especially with the ocular light therapy that we do.
Okay.
Some patients, it takes maybe 2 to 3 months before they start seeing changes. And things just start getting easier for them. Homework doesn't take as long.
It's like it opens up a new world to them like that.
It really does.
And you've had many, many success stories just like Seth's, huh?
Absolutely. And it's amazing what I hear from our patients. And beforehand, they're not aware that their visual system is abnormal. They're not aware that they're not supposed to be seeing the way that they are. We've had children tell us the words no longer move on the page. The words are no longer double. They used to blur. And again, children can have 20/20 eyesight and still have these visual problems.
All right. Well, if you think your child could be a candidate, if they're, if you have any inkling that they're having some problems and could maybe benefit from this, you can contact the Snyder Therapy Center. They're located in Columbus. There's the phone number. There is the website if you want to get more information about it, and also the address here in Columbus. Angie, we appreciate you coming and
Thank
sharing,
you so much.
opening up this world to us. We appreciate it.
Thank you.